Welcome to the Cerner Power Chart overview of Flowsheet documentation. In this video, we will review where most of nursing documentation is completed and how to review, modify, and unchart things. Whenever you enter a patient's chart, you're going to land on the nursing workflow. A few tabs down is our nursing flow sheet. When you click on that, you'll have access to different categories of documentation. Each of these categories are called flowsheet bands, and they contain smaller sections of documentation. Frequent documentation contains your vitals, activity, nutrition, hygiene, safety. Your assessment contains a head-to-toe assessment. I&O contains intake-output, and so on. The flowsheet defaults documentation display hourly. If you need to document an exact time, you can always insert a date and time. To do that, you'll right-click on the time and select Insert Date and Time. It's very important to review to make sure that you are on the correct date and have the correct time field. The flow sheet is essentially a very large Excel spreadsheet. It's important to line up the correct column with the correct documentation row. So let's go ahead and insert a time for 13:30. As we do that, we have a new column. We'll go ahead and double click to open this. When we double click on the time and have this check mark, it means all of these fields below are opened. This is much more efficient versus right-clicking and adding result, right-clicking, adding result throughout your documentation. So from here, we're going to document some vitals, and I will document some abnormal vitals to show you how they display. If you document something that is out of the defined normal range, you will get an alert, and it will tell you what that range is. This is not to discourage you from charting it, but just to make sure you're not transposing numbers. We'll say this is correct and we want to accept it. Anything with a little green calculator next to it is an automatic calculation. As you can see, it took our Celsius temperature and automatically calculated it to a Fahrenheit. From here, we will select temperature method. We can only select one. To get to additional tabs, you can tab through. The oxygen therapy options are multi-select. Anything with a little square to the left means you can select more than one. We will just go ahead and select nasal cannula. You can always skip down if you're hopping down a good portion of the flow sheet to continue charting. Be sure to pay attention to your different types of heart rates and blood pressures. As you can see, we have peripheral pulse rate, apical, and monitored, along with monitored blood pressure and manual blood pressure. Again, we have an abnormal value, and it's just checking to make sure we want to accept it. So with this, we have purple results. Purple results mean that documentation has not been signed. To sign it, you'll select this little green check mark in the left upper hand area. And once you do that, you will get some auto calculations for respiratory rate μ's. It's just saying based on our respiratory rate, it's going to score our μ's as a 2. Okay. So as you can see, we have 2 different sets of vitals in our 1300 column. It will display with a 2 next to it just to say that there are multiple results here. To easily view both sets of vitals, you can right-click and change your time display from Q1 hour to actual. You can see that our vitals are displaying in different colors. Anything that is critical high or low will be in red, anything that is abnormal low will be in blue, and anything that is abnormal high will be in orange. This is just a visual indicator to show that these values are abnormal. If you do need to modify documentation, you can do that by right-clicking and selecting Modify. From here, you can say if the patient was on 4 liters of oxygen. Do that. It's turn to re-sign it. If you've charted something completely on the wrong chart and you need to remove it instead of modifying it, you can right-click and select Unchart. From here, we'll ask a reason, and we have some pre-populated reasons that are the most common. If a reason's not listed in here, you can select Other in free text. We'll say we charted the heart rate just on the wrong chart. We never even got one. Okay, so this is telling us that it's also going to unchart our heart rate mu score, which is important. We don't want heart rate that's not for this patient to impact their mu score, so we'll go ahead and sign that as well. As nothing is ever truly deleted from the chart, we'll be able to see the error, and we can review the result details if we want to see what was previously charted. Same with our modified result. Anything that's been modified will have a blue triangle on the little right-hand side of the square. The flow sheet is essentially the same throughout different sections. As long as you double-click and open up the time column and chart your values, that's pretty much all it takes in the flow sheet. We can review different areas to get to different sections. You can scroll through. I recommend going and clicking on them as they're easier to find versus kind of getting lost in scrolling. For nursing, vitals, activity, hygiene, safety, nutrition are the big four in the frequent documentation area. Anyone who's on a critical care unit or is having some additional care maybe will document in these middle sections. The assessment is the head to toe section, and each section is broken up by body section, starting with cardiovascular, going all the way down to psychosocial. Our daily fall risk and Braden skin assessment scores are included in this section as well. Our pain assessment is located in its own band as a special call out. And our intake and output band includes every type of intake and output you could possibly chart. Again, it's important to make sure you have the correct date and the correct column when documenting these fields. Again, it's just as simple as double-clicking or inserting a date and time, entering your value, and signing. Intake and output will auto-calculate your intake and output totals and will also subtract the difference. Sections such as lines, wounds, drains, and tubes are a little bit different than our regular flow sheet as they have repeatable groups. Anything that the patient can have multiple of will be in a repeatable group. For example, our patient has a wound here. If the patient has an additional wound, we can select this little box and we can chart a second wound. To do this, we'll select the wound type, and this is where our wound name will come from. If they have an abrasion on their left arm, we can document the wound type, the location, and then document the activity. Again, repeatable groups are for anything that you can have multiple of. Patients may have many wounds, thus they have very many repeatable groups. Just be sure to look at the location to ensure that you're documenting on the correct wound. This concludes flowsheet documentation.